Kia ora, folks, and welcome to COVID Chat with me, Dr. Siouxsie Wiles, where we talk about the science of COVID-19 and answer all your questions. And joining me is Damien Christie from the Aotearoa Science Agency. Hi, Damien. Oh, do we have Damien today? All right, well, let's just crack on then, I think. Let's have a look at the numbers for today. So if we have 8 new cases today and a further 2 deaths, which brings our deaths to 11, which is very sad. So a big shout out to those poor families. We are really we're really thinking about you at this really sad time where we're all still in lockdown and people can't be with their loved ones. This is very sad, but obviously the reason we're in lockdown is to try and reduce the numbers of deaths that we experience from COVID-19. But every death is very sad. So yeah, we're really thinking about those families. But that's looking like a good trend. If we look at our actual total cases, we're up to 1,409. So again, really nice to see those cases being kept really low. And so if we talk about, 8 cases today, so we're in single digits, which is really great to see. I guess what we want to see now for the next few days going ahead is this continuing drop, single digits again. When we saw over the last few days there where it's sort of wobbled up and down, and what we'd hope is that it stays like this and then hopefully gets to 0. The other really reassuring thing about these cases is they're all linked to known cases. So there was nothing new that popped up. That's really reassuring as we look into moving out of level 4. Anyway, so let's talk about today's topic, which is, let's first get back to the worldwide situation. So the last time I was doing a COVID chat, we were approaching 2 million cases worldwide. We're now up at over 2.1 million. So again, continues to rise because many countries are still seeing exponential spread of the virus. But today's topic, life under level 3. We've been getting lots of questions about what's life going to look like for us soon. Remember, Cabinet are not making a decision about whether we move or what we move to till Monday, because they are looking for all of those numbers every day, and the modelers are putting all those numbers into their models to see what's the best date that it looks like we should move. But yeah, so let's talk about level 3. So the point about moving out of level 4, the point of being in level 4, right, is that we are trying to stop this exponential spread of the virus, which we have done. The point then about if we move out of level 4 is that we don't lose the advantage that we have gained by being in lockdown for these 4 weeks. This has clearly been very difficult for people, for the economy, for everything. And so what's really important is we don't squander essentially the lead that we've been given now, given that our case numbers or our daily cases are getting so low. What's really important is that we do really think about, if we move too fast, if we do still have some people who are shedding the virus, and we clearly do because, we're still seeing cases reported, that if we still have some of those cases around and maybe ones that we don't know about, then what will happen is that those people will shed the virus and will potentially transmit it. And then we will get these transmission chains starting up again, which then lead to exponential spread. So what's really important is that we are in a situation when we move out of level 4, where if there are some of these people who are transmitting or shedding the virus, that we can minimize that transmission. And we essentially do that. One of the best ways we have is what's called contact tracing, which you would have heard a lot of talk about. And what contact tracing is being able to basically, find people who have the virus and find out who they've been in contact with for the whole time they've had symptoms, but also for the few days before they have symptoms, because that's when they are infectious. And then to basically put all of those people into isolation in case they are infected, and to stop them from spreading it to someone else. So that's done by a team of people who will be phoning up, when a case comes to light, they will sit down with that person and find out all the people they've been in close contact with, and then they will phone all those people. So when we move out of level 4, we have to be really confident that if there are some people who are still shedding the virus, that we have the capacity in our contact tracing to do that really fast, to contact any people, because that's how we stop this exponential spread. And you'll have heard people talk about using contact tracing apps. So lots of countries have started bringing these things in as a way of supplementing the contact tracing done by people. And so I think we should maybe make that a topic for next week. We'll talk about what contact tracing apps there are and what are some of the issues with them, because even one of the developers of one of them has stated categorically that the apps cannot replace completely the people who do the contact tracing. So we'll talk about that next time. But anyway, so what does level 3 look like? So the whole point then is that contact tracing is really easily done when we're in our bubbles at level 4, because the people that we come into contact with is really limited. So as we move out of level 4 and into level 3, what we really need to do is maintain the small bubbles and the limited contact we have with people, because not only will that limit the spread of the virus, but it will make the contact tracing much easier. So what that means is, for most of us, level 3 is going to look very similar to level 4. So if you can work from home, you should be working from home. The schools will apparently be open, but with very strict measures in place, and they are relying on children whose parents can keep them at home to keep those children at home. So some more businesses will open, but again, there's going to be really strict rules around how many people, how far apart they need to be from each other, precisely to try and stop this transmission. So we will start to see a little bit more opening up of things, but for most of us, it is going to mean we still stay at home. We might be able to do some online shopping, which will be awesome for those things where you realized, oh no, we need that, and we aren't able to get it. So that might happen for some things, but for most of us, we will basically stay at home. And this is really important, because I actually had a couple of questions from people saying, I'm immunocompromised in some way, what happens to me? And the thing that happens to you is that you still stay essentially in lockdown. So one of the things we have been told is that we can expand our bubbles a little bit, but this is not a big expansion of bubbles. So the Prime Minister was quite clear about this, where, for example, if people are working and they need to bring a caregiver, maybe for children, that person can come into their bubble, but that person will then be part of that bubble. They won't be able to be part of another bubble. So maybe if you are sharing caregivers, that won't be able to happen between families. It will have to be just sort of one exclusive thing. Same if you want to expand a little bit with your family. Well, you can't have that expansion, but then they're allowed to go and see other people. So think of it as a bit of an exclusive relationship where you can expand your bubble to somebody else's, but they cannot expand again to someone else. So this might, you might find out which family members prefer you versus some other family members, I guess. And I guess the really important thing to say is that this whole idea about level 3 working is it's only going to work as well as we make it work, right? So this is all on us. And the whole point about this is we're trying to, eliminate the virus. We're trying to, manage and minimize this. And the better we do that, the faster we will move out of these levels and into something that's where more of us can be moving around and interacting. So we need to treat it like it is level 4 and stay with it, that try and stick to the rules as much as possible, because the more we do that, the sooner we'll be out. All right, so let's bring Damien, if he is around now, and we'll have a chat and answer some of the questions.
I am indeed. Sorry, I missed the start of the show. There was some technical issues going on there. Hello, Siouxsie. So level 4, it's like level 3.
Hi,
So
Damien.
level 3, I heard someone saying, hi, level 3 is like level 4, but with KFC. I saw someone describing it as, and I thought it's not a bad description. For some people that might mean school, but the bubbles, was it your graphic with Toby Morris that I saw that looked at what happens when a bubble, one person adds a bubble there and then the other person adds, and then eventually it just ends up being one basically
They're
society-sized
all
bubble that doesn't
connected.
work. Because we were talking about this with, if you send your children to school for whatever reason, but then you're also catching up with your family members, but then they're sending their children to school as well. Suddenly that bubble could be very large indeed, couldn't it?
Absolutely, yeah. So it's all about exclusive relationships, minimizing the size of things, and there will be people who need to go back to work, and so that's why there's going to try and be this allowance that that some schools will be able to open up, but there are going to be, and that might end up being that children are put into bubbles. So again, to limit contact and minimize the number of people that they're interacting with. Yeah.
One of the questions that we've been hearing around, when will I be able to get a haircut? Because I don't know about you, but people are calling me hippie now when they see me on this show. What's it going to
I know.
take?
Have you seen the size of my roots? It's not level 3, I'm afraid. It's going to be some while longer yet. Yeah. So one of the businesses that are not going to be reopening are those where people are required to be in close contact with other people, and so where they can't really put things in place to minimize that. So I know I spend an awful lot of time with my hairdresser. That would be like coming in my bubble, and so I'm afraid you're going to be seeing my roots get even longer and my hair getting less and less pink. So yeah, it's going to be a while for the haircuts. Maybe there's going to be a big splurge on hair clippers, and there's going to be an awful lot of very bad haircuts for a while.
There's a question from Pat, which I think we've already answered about. Can we go and meet our extended family and close friends outside our bubble? Again, only to the extent that it's absolutely exclusive, and you'd have to choose one of those, and not all your friends and whatnot. Let's jump into John's
Yeah.
question, though. I see DHBs have been asked to up their testing in the regions. Can we assume that this will include testing of virus-exposed workers, health and supermarket workers, and if results are positive, this will be the last piece of the puzzle to allow shifting from level 4 to level 3?
Yes, so actually, this was announced, I think, yesterday was the first of this. So, one of the things they're doing is going into some regions and testing in supermarkets. So, testing supermarket workers and people who are at the supermarket. It's all voluntary. They're not going to shove one of those things up your nose if you really don't want it. But this is all about seeing whether are there any hidden cases? Are there any people who are in those few days of before they get symptoms, or if they've got very mild symptoms and they're heading out? Are there any of those? And my understanding was the tests that were done yesterday were all negative. There's more being done today, but that's being rolled out. So this is the thing that's going to give us much more confidence that the cases that we're all seeing are the ones related to clusters. And that's really important for us moving down the levels.
Question from Kaz. Do you know if walking through the secondhand smoke and vape of a person with COVID-19 is a risk? Could a person catch COVID-19 from that? I always wonder when I see someone vaping or someone's vaping and nearby you, and it's like, that's your lung juice that I'm sucking in there, isn't it? Is that going to be a risk of infection?
Yeah, so I spoke about this a while ago. Actually, I asked some respiratory physicians about this, and so the one of the big concerns was that the vaping pen, takes the liquid and it essentially vaporizes it, which is turning it into this cloud. And so, could that do that with the virus? And it doesn't. Their feeling was very much that doesn't do that with the virus because it's just vaporizing the liquid that they're breathing in. And it really would just be like somebody doing a big exhale, which we all do at times. What we really know about transmission of this virus is that if we look at all the clusters and everything like that, it's where people are in close contact with each other. So if you are standing with somebody having a conversation while they're vaping, and you're doing that for a long period of time, then that could well be a way for you to get the infection. But it would be the same as standing with them and having a conversation anyway, or singing or something where you are putting those droplets out into the air and potentially them landing on your face or breathing them in. So yeah, I don't think it's specifically for the vaping. And certainly if you walk through a cloud, I think that would just be the same as basically, we should all be trying to avoid these things. So I would, if you're a vapor, don't vape in the direction of people. And if you're somebody who's approaching a vapor, maybe do them a very wide berth.
Yeah, I do tend to find when I am having conversations with people, they often sigh very loudly in my direction. So I might just stay away from talking to people for a while. If we, question from Travis, if we have a strong immune system, will that reduce our chance of contracting COVID-19? If so, how can we strengthen our immune system? There's a lot of, we're seeing all the usual sort of natural medicine advice coming through. Take some vitamins, do this, have,
Immune
tincture
boosters.
of garlic. Yeah. Yeah. What do you think?
Yeah. So actually, there's a lot we don't know about whether people with a really robust immune system are actually going to have a more difficult ride, because certainly some of the damage that happens to people happens because of your immune system responding to the virus. So I think that it's good to be in good health. The way that you boost your immune system is you sleep well, you eat well, and you exercise. Like those classic things. There really isn't any evidence that taking the supplements your immune system kind of supplements will actually do any good, unless you have a terrible, like a terrible diet or something. But fruit and veggies, and having sleep. And stress is a difficult one, because obviously we don't want to be under too much stress, and we're all under a huge amount of stress. So be mindful about how you're eating, and taking some time out. Maybe try not to get into the big kind of we're all supposed to be being really productive because we're working from home. It's like, no, we're at home during a crisis, and we will try and be productive, but it's okay if you're not. So if you just need to hang out and watch Netflix for a bit and recharge, then that's fine. These things will all help your immune system.
We've got a question on Facebook from Siren. How can school be considered? When you do, if you do have to send your kids to school, how could school be included in the idea of an exclusive relationship?
It'll be about the kids, putting the kids into bubbles so that they will be minimizing the amount of contact with other children. So yes, you will be expanded to their households. It's not ideal, but it's also, this is part of the kind of risk benefit of, people want the economy opened up, and they want access to things, but that has to be done. There are things that are going to have to be done to allow that. So minimizing the chances of transmission, and then making it so that if transmission happens, it is easy to stamp out. That's going to be the goal for level 3.
Cool. We're getting lots of questions about, your thoughts on moving to level 3. Is it too soon? Is it too late? Should we do more? Should we do less? We are trying to stick to the science on these, and rather than sort of getting too involved in politicized debates, because it's not a pretty place to be right now. But I would say that Jean from Waioku says, I love these chats. Hi, Jean. It's lovely to have you here watching. Let's move on to one of the next questions that we've got, which is from Amy. I've heard that novel viruses, as they age, become less deadly. Is that true? If no vaccine is able to be developed, is this a pandemic that's just going to bounce around, or in a year or so, will it be less nasty?
That's a great question. Do they become less deadly? That's a bit of actually not clear that they would become less deadly. It all depends on how they mutate and what directions those mutations come in. It's not a given that they would mutate to become less transmissible or less deadly to the immune system. So that's a bit of we'll just have to see what nature throws at us. And that's kind of why we're also trying to eliminate it. So yeah, we don't know whether it's going to bounce around. We don't know. What we do know is that if it is present in other places of the world, what we have to do is minimize what happens to it getting back into New Zealand. That's going to be the big thing. And so what cost that will, how we will do that in a way that allows us to open up our economy and those kind of things are the question that us and other countries that are on the same path as us are going to be trying to answer. As for, so there's also a bit of a question around, like, do we actually need to do the herd immunity thing? Then we've talked about this before, that actually some really interesting data is coming out from overseas, just at the level of herd immunity. So this is where, enough people have had the virus to enable it to enable everybody to get back to normal. And those countries that have still got huge numbers of deaths and cases, actually, they're still only at about 6 to 10% or maybe even less than that, of people getting the virus. So an awful lot more people are going to have to die before they are at anywhere near what herd immunity would be. So it's becoming a less and less off the table with every day that goes by. So yeah, what we're trying to do is make sure that here in New Zealand we eliminate it, and so we can figure out what getting back to normal looks like for our country.
There's been a couple of questions, and I see a lot of chat online as well, articles coming through about the whole second wave thing. I don't know if that's something we want to talk about here, but basically it's once we should maybe talk about it on Monday, once we had a chance to sort of look into it a bit more. But the idea that once we get rid of COVID, are we setting ourselves up for a whole second wave, which could be just as bad? Should we talk about that next week?
Well,
Talk about that now?
I can talk about that briefly now. So there are two ways you can get a second wave. So you can get a second wave when you're like us right now, where we still have cases, and if you lift the controls too soon, and you make it too easy for the virus to transmit and too hard to contain it, then you get the second wave. So that's the thing that we are trying to actively avoid right now. There are then the second waves that come from from introduction of new cases, and then when you haven't seen them coming in, and then you don't take the steps to stop them. So this is what some countries are seeing, where they are starting to see cases not in the people who they'd seen them in before, but I think in one particular case it might be in migrant workers. So they've opened up their economy again, and their economy involves lots of migrant workers coming over to work, and they are living in not particularly great conditions, so crowded conditions that allow the virus to transmit really well, and they are now seeing exponential spread of the virus within those communities. And so again, they get back to, well, now we have to stamp it out in that community. So it's all about what measures you put in place to ensure that if any of those cases appear, they don't run away before you realize that they're there.
Can you please talk about a question from Tony? How reliable are COVID test results? And there's a question on Facebook as well. Someone saying that they tested people on an aircraft carrier, and a huge number of people were tested positive but were asymptomatic, and they're wondering about whether that meant the test is bad or wrong. Can we talk about that?
Yeah, I guess it depends which test you're talking about, because there's obviously the test we do here in New Zealand, and which most other countries do, which is the test that's the genetic test. So this is looking for the presence of the virus, and so that is dependent on the swab. So that's, I think the most reliable one is the swab that goes right down the back of your nose, but there are other people who take it from the mouth, and then. So that's about, is the virus there, and is it there in large enough quantities for the test to pick up? And my understanding is the test is getting more and more sensitive. So it's, was it done right? Did it get the virus, and then did the test work? And I don't know what the percentage of positives and negatives are from that. I have seen some data where they were following people over time, and it looked like they kind of went down, and then like they might test negative and then test positive. And this just might be about whether you're really at the limits of how much virus the test can pick up. There's also then the other test that some countries have brought in, and some countries have tried to bring in and have been utterly unsuccessful, and those are the blood tests. And these, a huge number of those have kind of come on the market. So I don't know whether you remember, but maybe a week or two ago, the UK was talking about how they were going to roll these tests out, and they bought millions of them, saying within a week or so we're just testing them out, and within a week or so they're going to be available in pharmacies, and people will be able to go and test themselves, and this will tell them whether they've had COVID-19 or not. That has been completely abandoned. They spent millions, and the tests are completely useless. So it's a very difficult thing with that test, where they're finding that many of those ones are completely, they've got so many people test negative who are actually positive that they're not using them. So the test that we are using, my understanding, that is the gold test. It is the gold standard. It does rely on being able to extract the virus, and so there are some little complications with that, but that is the test that is being done routinely, and we have lots of labs set up to do that. But I will see if I can get a number for what the false positives and negatives are.
One last question, and I'm going to choose. Which one should I do? Should I do this question about recovery phases or the one about the fat-busting ingredients?
Let's do the fat busting because I think this has come up a few times. This is a news you can use.
Okay, question from Marie. So, yeah. What are the water-attracting, fat-busting ingredients I should be checking for in hand washing products to make sure they're doing a proper job and not just making my hands feel nice and smell good after 20 seconds? That's from Marie.
You're looking for a surfactant, and the most common surfactant is sodium lauryl sulfate. So if it's got that thing in it, that is the thing that is lifting the oils and the virus from your hands, and it's the action of actually rubbing them and doing that, and then getting them down the sink. That's the best bit. Remember, here in Auckland and lots of bits of New Zealand, we've got terrible levels of low levels of water. Drought. So you do not have to run the tap for 20 seconds. Please don't run the tap for 20 seconds. Just wet your hands, get them all lathered up, do your 20-second sing, happy birthday, whatever it is you're going to sing, and then put the tap back on. So let's save some water while we're also washing our hands.
That's a really good message if my 5-year-old Eddie is watching this, who has the tap blasting and then gives his hands probably about a minute wash, and I'm just going, no. I do appreciate his dedication to the cause, though. All right, well, look, that's it for us. Thank you. If you've got questions, and I know plenty of you have, send them to nzcovid@gmail.com. We'll be back again on Monday with the show. Thanks to the Science Media Centre for helping us out. Thank you, Siouxsie. I hope you have a lovely weekend, get some relaxation in. We're going to end with and same to you out there as well. We're going to end with a little snippet from a song that I just found. I thought, this is cute, and it feels like a really Friday vibe. I think this may be my knowledge of Southeast Asian languages is right up there. I think this may be a Thai song that was written to combat COVID-19. So we'll see you next week.
See you next week. Thank you.